Hello everyone, welcome to Go Campus. This is Ashwini with you. Now today we're going to discuss about post-graduation in emergency medicine in the UK. Now emergency is a very dynamic branch. I guess every case is different and challenging. No other branch has so much advantage of treating of all age groups, diversity in patient presentations, and the fact that you are a frontline physician mostly dealing with the life-threatening situations, I guess gives you the utmost satisfaction as a clinician. Now, if you've decided emergency medicine is for you, if you've decided this is the field for you, then this video is for you. So, in this video, we will quickly brief you on FRCEM plus MBA 2+3. That is 2 years you'll be trained in India and 3 years in the UK. Indo-UK PG training program by BTA. This is a 5 to 6 year training program where you'll be trained in India for 2 years, after which once you successfully meet the required core competencies, you'll be posted in the UK for your further training. Now, Fellowship of the Royal College of Emergency Medicine is a postgraduate degree awarded by the Royal College of Emergency Medicine for the specialists in emergency medicine field. So now I'm going to quickly answer a few common queries which we've been receiving by the doctors by emails and calls. So the first question, I think most of the doctors are familiar with MRChem. So I just want to give a quick difference. Now the Royal College of Emergency Medicine offers a range of examinations which will lead to the award of membership of the Royal College of Emergency Medicine or the fellowship of the Royal College of Emergency Medicine. So the FRCEM examination consists of following exams. As you can see on your screens, it's FRCEM Primary, FRCEM Intermediate and FRCEM Final. So if you complete FRCEM Primary, FRCEM Intermediate and MRCEM OSCE, you will be awarded with MRCEM. If you complete the full suite of exams, that is FRCEM Primary, Intermediate and Final, then you will be awarded with FRCEM. FRCEM Intermediate has got 2 parts and FRCEM Final has got 4 parts again. So I'm sure now you know the difference between MRCEM and FRCEM. FRCEM is what you'll be awarded with when you complete the full suite of exams. MRCEM you'll be awarded with only when you complete the first 2 parts and finish with your OSCE exam. So the next common question that we receive is FRCEM recognized in India? Yes, FRCEM is recognized in India and definitely it is recognized in a lot more countries. Will MRCEM, FRCEM open job opportunities outside India and UK? Yes. It is a highly credible degree and it's recognized internationally. It definitely opens up good opportunities for you once you've completed it. Is this program or course recognized? Yes, it is recognized. It is GMC sponsored route. The official link is mentioned in the description below. Is PLAB required? No, PLAB exams are not required for this. It is a PLAB exemption route. You don't have to give your PLAB exams for this. Okay. So the next question that you have is, will I get CCT after completion of my training? So all of you can see your screens now. This is the training pathway in the UK for the emergency medicine. So when you complete your specialty training in the UK, you will be awarded with CCT. So now there are 2 options for you. Either suppose if you want to go towards the CCT pathway, you can move to the training posts after you're posted in the UK. The other common pathway is CESR pathway. To discuss more on the pathways, you can certainly reach out to us. We can discuss in detail about it. The next, should I pass all the 3 exams plus MBA in India? No, you don't have so much pressure. In 2 years, you're only expected to build competencies in emergency medicine, as well as you're expected to pass only FRCEM Primary. Your intermediate and final will happen in the UK when you're posted over there, as well as your MBA will also happen in the UK. So here you don't have pressure to pass your MBA exams. You only have to focus and build all the required core competencies that is required. The next, will I get paid? Will I get salary in India and when I'm posted in the UK? Yes. In India, based on the location of the training hospital, you will be getting somewhere between 30,000 to 50,000 per month. And in the UK, you will get as per the UK standards, somewhere starting off from 3 lakh per month. It might be more than that, but I'm just giving you an approximate figure. Now, many doctors ask us, is MRCEM or FRCEM exams tough? Especially we are getting to hear this question from most of the doctors who are aiming at getting into MAM. Of course, compared to MEM, MRChem or FRChem, they are much more challenging exams. So the pass percentage of the exams is put on the screen now, but if you work hard and if you're trained well, I don't think it is really that tough, because we are seeing a lot of doctors who passed FRChem Part 1, who passed FRChem Intermediate, and they say as long as you have the required clinical skills, it's not that a deal. You can certainly nail the exam in the first attempt. I guess this is one of the most common confusion which young doctors have. You're confused between should I choose MD or DNB in emergency medicine, should it be MRChem, FRChem, or should it be MEM? Now this depends on where you want to practice, and it's a very personal choice, but certainly I'll try my best to help you in your decision making process. So the major difference is, now our MD in emergency medicine or DNB in emergency medicine is recognized as a postgraduate degree qualification in India. When it comes to MRChem and FRChem, yes, this is recognized in India and UK and many more countries across the globe. Now, you don't even have to complete your full suite of FRChem exams. With just MRChem, doctors are finding quite wide job opportunities across the globe, not just in India or UK. Now, coming to MEM. Now, MEM is not recognized in India at this point of time as a postgraduate degree. It's neither recognized in US for your residency, and neither it's recognized in UK to enter the specialist register in emergency medicine. Now, we are working on a fast track program for PG doctors, that is, who've completed emergency medicine in India, either it is MRChem, all the parts, or MD or DNB. So we are coming across a lot of CVs, a lot of applications. Doctors who've completed MEM have completed MRChem after finishing the MEM. So what we understand is definitely MEM gives you the good base to prepare and to face your FRChem or the MRChem exams confidently. So again, so it's your choice. Do you want to do MEM and then work on MRChem or FRChem, or because this program has come up now, it is one of the most interesting and a very unique program for the very first time in India. The first batch is already joined, and it's already been 6 to 7 months that the first batch is joined and is in the program. So now the applications are open for the second batch. So now about the selection process. You will have 3 rounds of interviews, that is CV, clinical approach and ethics station. You will be assessed by panel members both in India and the UK. So tentatively the joining date, the start of the program is in the month of August. So doctors who are more keen to know about the application process and who want to know more about the interview strategies, and you want to know more of the fee structures, request you to please contact us. The contact details are mentioned on the screens now, as well as in the description link below. Thank you so much, and all the best.